to the floor. Good afternoon. We should like to continue with the works of this conference with a roundtable that I believe was highly anticipated and very eagerly expected, not just for its composition, but also due to the title. The title is Political Consensus, Commitment and Collective Action for Health System Improvement. Lots of promises here, lots of stakes contained in the same sentence. It's a huge bet. We heard a lot of great things. And it confirmed everything we did here that, health is a rapidly developing and growing field, and stagnancy in implementing reforms and making decisions can be a very painful thing indeed. Something that is confirmed every time we talk about health is that the key feature, the main characteristic, is total uncertainty and, surprise of all those who make decisions by extreme conditions. For instance, the fiscal crisis and the memoranda that hurt violently the sector of health. Another one is the recent pandemic. No one expected that modern societies and modern health systems would be found against themselves such a colossal pressure that they could not cope with, even the most strong among them. So within this framework and this data, we're talking about the possibility to achieve political consensus, which is necessary because the reforms are very crucial and critical in the field of health, and there are multiple pressure groups and interest groups that are hurt at the same time. So it takes either political alliances and consensuses or some offsets for the groups that are felt being hurt in order to achieve the necessary consensus to implement these policies. One will say that this does not suffice and that other things are needed, such as the achievement of reforms at the proper political time. I would be remiss if I didn't point out that the emblematic reforms in Greece happened at a very bad conjuncture. Usually it is under pressure that we dare change things in health, despite the pressure from this sector. Another thought I'd like to share with you before I call to the podium our established and learned colleagues is the results of a study that's been running for 7 years. Now, for 7 years, we've been ascertaining that 75 to 80% of the population is doing systematic use of health services. So there's a field of regulation that concerns everyone. Another one is that 1 in 3 has problems and obstacles to access the health system that come even under very positive fiscal conditions. 1 in 3 states that they have the intent to pay additional money for health services. Let's put a pin on this. And citizens say that the inability to implement the necessary reforms in health is primarily due to the lack of political will and the political cost that it entails compared with the reaction of political pressure groups and interest groups. So this shapes and forms a field that is very demanding. It is a very difficult thing to regulate the health sector. It's one of the most complex areas of public policy and politics. And this is the environment in which we'll talk about the possibility to achieve consensus, political consensus primarily. Commitments vis-a-vis the society from both sides. I mean, it's impossible for the minister to change, the general secretary or the government to change, and for a plan to change because they want to bring their mark and to place their mark on health. These are the stakes, I believe, in health, and this is what we'll discuss with the exceptional speakers we will have at this roundtable. I'd like to thank them all for accepting our invitation. I should like to call to the table the alternate Minister for Health, Lung Specialist Mina Gaga, Mr. Stamatis Vardaros, who is health advisor of the president of SYRIZA, Mr. Tassos Giannitsis, Professor Emeritus and past Minister of Social Security and Social Insurance, I think. Unfortunately, we have just been informed that Mr. Andreas Loverdos will not be able to join us due to an unforeseen commitment, which means that we have extra time for our discussion. Can you hear me? I should like to welcome you here as well. Now, Mrs. Gaga, you have the floor. You have 6 to 7 minutes to make a brief introduction. Right, I believe that this is a very good introduction, and I heard the previous speaker say very interesting things. The world changes around us. We have different technology. It's the patients who are much more active, but they need to be more active. And health becomes, it is a necessary thing. It needs to be accessible to everyone. It needs to be sustainable. And in order to better organize it, we all need to be together, to stand together. And not just talking politically, but all together, the doctors, the medical technology companies, pharmaceutical companies, the patients, all those who have anything to do with health. So let's start from the first thing. The first thing is to have the data. The second thing is to listen to the patients, to listen to the health users, to listen to those who produce products to be used by the health users, because those who produce something need to feel that they do so and have something to receive in return. And we need to be certain that there are some rules, that everything we need for health is really sustainable. And I really understand that we need to have some benefit for something that is offered on the basis of research and has a huge cost. But we need to make sure that it's such a benefit that the health systems and countries and states will make it over time. And it's the benefit of everyone, of the patients, of the systems and the countries, but also of the companies that produce the products that are needed to be purchased. So let's start from this, that the systems evolve. And as already Mr. Souliotis said, that in Greece we saw two big changes over the past 12, 14 years. The memoranda that changed the funding of the national healthcare system and of health in Greece in general. And second, coronavirus, a crisis that proved that health systems need to be flexible. And this, I believe, is important for us today. Everything we plan needs to be flexible. Now, we need 1,000 units, 1,000 beds, 1,000 beds. But in a pandemic like this, we may need 1,500. This we need to have the possibility to do, to change, and we need to have the possibility and the capability to staff everything on the basis of the needs of the patients and not on the basis of calculations we made without absolutely no data. So one thing is that we need to have all the data there and have the possibility and capability to change the use depending on what we need. So let's say that we're on Crete. There is an earthquake and we have 200 injured people at hospital that normally has 30, can accept 30 people per day. I mean, we have big hospitals. I mean, Narkalοχώρη, we had Pagni and the Venizelion hospital, and the two hospitals that were large and have a lot of staff that could do it. It could have happened near the hospital of Ierapetra that has very little staff. So we need to have the possibility to move our potential or to change our structures on the basis of what we will need. Now, I heard that the Stavros Niarchos Foundation, an architect, say that he was asked in France to convert a car industry into a hospital. So he needed to convert an existing building to a hospital, and they needed him to build a parking lot that has a huge cost, and he didn't want to do it. So he went to Israel while he was drafting the plans, and he realized that the hospital parking lot has, its entirety has oxygen supply, and it can be turned into an ICU very easily. So he said, yes, I will make the parking lot. So we change, and we change by seeing the systems and the possibilities of what we want to do in Greece. What do we want to do in Greece? So we listen. We get the data, we listen to the staff, and all the more so the citizens in all areas of the country. We see how many use health in their country, how many move to a different place to receive health services. And talking with the people, we trying to draft the health map, which is very important for us all. An example, the island of Paxi, they have 3,000 permanent residents and they have a health center. It's impossible to build a hospital there. I mean, it's easily understood by everyone. We can't have all the cases dealt with there. In these incidents, we have more incidents in summertime, and we can send more doctors and nurses in summertime to meet the increased needs. But the health structure cannot be a 400-bed one and 600 doctors, because the population is that of 3,000 inhabitants. So all things can happen on the basis of what we will need, what health use we can make in each place. And there needs to be collaboration, which is the other model we're interested in. So Can I make a specific operation at a certain center to have it very complex? I will not have it in Lefkada, for instance, but if I have 3 patients, instead of moving them to Athens, I can move myself and go do the operation in Lefkada, and to have the patient's family there to be able to heal in their environment, their home, easy things that we can discuss about and we can collaborate on. Another big weapon we have is digitalization. All Aegean islands have the possibility for telemedicine. So even a young doctor can discuss with a reference hospital, with a specialist regarding any problem with their patient. A thing we change immediately is the emergency rooms, and we are in consultation with the urgent medicine company, and we raise the education levels, and we want all the doctors at the TEPS. We don't have them already. We are creating them to be able to be certified doctors, so that any doctor, any patient who has an acute problem in any part of the country to receive the care they need, be that a trauma or an infarct or an anaphylactic shock, or they have a simple dyspnea, and to be able to either be hospitalized in the health structure they have been into, according to the capabilities, or to be transferred, but to have the first aid, proper primary health care to save their lives no matter where they are, be that mountainous Chios or Zoumerka or the Evangelismos Hospital of Athens. This is a big bet, it's a huge stake, it's a big change that we believe will help everyone. The second thing we change, and you will start experiencing it in a few months, it will be completed in 2 years. It's the TEPS. The TEPS become single and unified. Patients can follow 2 routes. One route that is for ambulatory patients, and another one for more heavy patients. We will not move patients from a medical center to medical center, from doctor to doctor. The doctor will visit the patient, depending on their needs. There are just a few things. I think I've overshot my time, so I will put a stop here and we'll go on. Yes, we'll have opportunity to have the discussion. I would like to keep what you said about the evidence-based health policy, because it will help us fiscally to be more disciplined and also to be certain that we do is rational. I should like to give the floor to Mr. Vardaros. Mr. Vardaros? Good afternoon. I should like to thank everyone very much for the invitation. It's a very difficult conjuncture, and I think it's difficult for a number of years. And we're talking about that due to the fiscal adjustment over the past 2.5 years and the pandemic. But it's a difficult subject that this panel has to deal with, because the difficult thing in health policy, at the end of the day, is to look for consensus and for agreements. I'm talking about the political forces and the academics as well. I mean, it's a more elegant way in which academics express their differences and their objections. At any rate, when the invitation came, what I started thinking was bullet points, that with emphasis on the public healthcare system, that we could find some political areas of meeting points. And the most easy thing that popped to mind was the Doxiadis plan. The most progressive project, plan, innovation that came from a conservative politician, rare in the late 70s, early 80s. It was not implemented then, but it was implemented by PASOK in 1983 by Paraskevas Avierinos and Yorgos Giannitsis. And this is a success story that lasted for 40 years. With all the difficulties and the problems it entails, it still lasts 40 years later. I think that's the value of the national healthcare system and the need for further enhancement thereof. It is a point on which we can and we should agree on. It's the way we do things that is different, but this is indeed a matter of public debate to resolve and of political dialogue. I believe that in the period that preceded these 2.5 years as regards the public health system, we did have a shift of sorts, both at the level of idea and political approach. And I would be remiss if I didn't say that in the first period, in spring 2020, And here I would preempt some questions. Yes, you are with the opposition, and the target and your aim is to point out the problematic points and the key issues, the ineffective things of government management. Yes, but this is not all we do. The first period of the pandemic was a positive period of dealing with the health crisis. And I believe that this happened for very specific reasons. It happened because, quite appropriately, the natural leadership of the health system had the main say. And I'm talking about the experts committee. The communication tools at the disposal of the government were used in a relative, I wouldn't say sparingly, but it was as much as it should. Okay, I mean, and this changed in due course, and I believe that therein lie the difficulties in individual issues such as vaccination or the management of cases that have fueled political debates of a different level in a different climate. I mean, the approach of the government has changed ever since, and of course the reaction of the opposition to the management and handling of the health crisis. Of course, it was trust and confidence, rather, in the public, in the national healthcare system. And I'm saying this because we have people from the market in the room, and you know this better than I do. This is not always an adversarial relationship. We believe that investing in the public health system is a growth choice, because through its growth it gives more room to the market and to make opportunities for investments and for further activity or furtherance of the activity. So this is a part I should like to focus on. The second thing is things that Mr. Souliotis mentioned earlier. Mr. Souliotis rather, said that political formations have a tendency to reject or to set aside successful examples of previous governments, or either reject them or to allow them to fall into disrepute by not using them. So there are consequences in the politics and the policy of health over the past 2.5 years during this government's term of office, and there was work done by the previous government that was put to good use, in my opinion. The very good work done at the level of digital infrastructures that was utilized, and was utilized positively, both during the pandemic and in the use of health services by the citizens. I don't know about the health system management. I don't know whether we have a better picture of the situation, and we did have this difficulty. Monitoring the health system or the management of the health system is a timeless problem. This on time that we call it, it's usually the data, to connect with the previous reference, the data come in a delayed manner to those who evaluate and make the decisions. So this is, I believe, a point that I will be happy to hear that progress has been made, and maybe it's a target for the next period on which we can agree. The part of receivers participating even in the decisions or the management of the health system, the healthcare recipients, is an issue where consensus has been achieved. It's a request on behalf of the recipients, and I believe that it's very difficult for political forces to find things to say against it. And it helps with the efficiency of health systems. It helps with transparency, with management, with procurements, with everything. And one more issue that is very important has to do with accountability. The accountability of those who have positions of responsibility in management. And these are interventions that you very well know are not costly, financial, fiscal cost, no cost. But they help very much in enhancing the reliability of the system. I'm referring to the example of establishing social accountability of health structure managements to the local societies. We did this very systematically when we were in power. I don't know whether it stopped completely, but I haven't seen for quite some time a similar initiative. I beg to disagree, because I was in the system. There was none. There was none. Not in the past, not just in the past, but there was none. Now I believe this is a point of disagreement. Now, I'm talking about the open accountability to local societies, that you could hear anything ranging from very serious things down to opinions that were borderline serious. But at any rate, it gave the impression that health services had some connection and some link to the local societies. And it was very important in the everyday life of the health system. And it was very important in exercising management by the people who had the responsibility to manage the health structures. I would like to close my parenthesis here. But I believe that there are cases in which the government could continue some positive steps taken by our governments. Another one is the interpartisan committee on drugs. It was an effort to co-shape decisions. The area of the drugs, it's very sensitive, critical, and very expensive, if I may, area. It's a matter, it's a spearhead. Okay, if we can have consensus on behalf of the political forces, the more we have consensus, the more we can allow the market to plan ahead with some greater safety or security, if it's possible. But even at the level of financial management, we have a bigger safety and a better management, ease of management. Another issue, I don't know how we're doing time-wise. It's another issue that I believe that this government could carry on. It was an important intervention for us. It could be modified or changed. It's the primary health care. And I'm talking primarily about the local health units. They started being developed. During the previous government, we had 127 in place. It's a common understanding through the evaluation reports and from what we perceive from the local communities with a very positive mark and footprint, was that the estimate we had is that institution ceased, or rather paused, if I may. I didn't want to say ceased, I said paused. It was, of course, dragged by the pandemic or the low priority it had, and it fell into disrepute and disuse. And 3 years later, I'm taking into consideration the health crisis as well, the government comes again with another legislative proposal in the area of primary health care. It's the personal doctor. Parts of it were part of Law 4486 of 2017 to go into an entirely different rationale with improved financial terms. We need to accept that and acknowledge that, both for private doctors and public doctors, public health system doctors who will participate in this institution of the personal doctor. Let's see how this works. But what I maintain is that in a country that has a rather privatized part of primary health care, I think 80% of primary health care expenditure is private sector. It's covered by private sector, if I'm not mistaken. The parallel development of public structures would improve tangibly the level of services to the citizens. This is something I should like to point out as a point that continuity could be observed. And at the end of the day, we heard a lot about the Tommies, that they were Soviet-inspired units, and I'll be rather provocative to say that, well, we wish that the European Union funds to fund such structures. They were not Soviet structures. Alternate Minister says, well, no, I did not say that. The response is that, yeah, of course, it was your predecessor. But in fields where we have a distinct, or rather a marked monopoly presence of the private sector, the development of services on behalf of the public health sector that can be beneficial for the public interest may have an important regulatory role to cover needs that many a time the private sector understands their coverage differently. For instance, the primary healthcare structures that have interventions as well in public health, and it's not easy for the private sector to do interventions in public health. They will, well, private doctors will not make an epidemiological evaluation. There's no scheme to intervene in the community, in the promotion of health. Why, says alternate minister, why can't they? What, in an organized way? What, a freelance doctor? Yes, of course, why not? What, the checkups and the prevention programs? I think it's a one-use, single use. No, there needs to be a change of mentality from the doctors that starts from education, training, and goes into the way we do medicine in the primary healthcare. This is what I mean. Okay, I beg to differ. I insist that these public structures. Well, of course, I'm interested in the public health system, but there are people who provide services who are in the private sector and people prefers them and go there, and they can do their work very well and to do it in an organized manner on the basis of instructions issued by the public sector. I mean, okay, it's the duty rosters, and then the duties, it's something we know. Well, madam, of course I'm not referring to that. It's still happening. The more protocols you have, the more evaluation and assessment tools you have. The part of governance of this system and the cooperating providers plays a role and is very useful. What I'm saying is that organized prevention and community intervention is a very difficult de facto thing to be done by the private sector. There, you need the public structures. I will respond to that, says the alternate minister. So you need the parts of the social state to communicate with one another. Yes, it goes without saying, says the alternate minister. So I believe that the government did not assign the gravitas it should and the priority. I don't know whether it was a political choice that is there. It was a choice. Yes, I will answer to that, says the alternate minister. Yes, I'd be glad to hear your answer. So you said, and I heard it very positively, about progress in the TEPs. It was a very important thing to actually make new jobs in the TEPs of the country. Of course, there was the institutional shell that needed to be completed, and it's a very important thing to see this progress. And also parts, to come to a conclusion, parts in which we believe that we need to agree, and there is a field for consensus. It is the need to enhance and support the healthcare system. And there is a need to staff people more. So it was not 5 or 10 years ago. So you know very well the systems that are based on the human factor are very difficult to be built. They're very easy when you don't work in the way you want and the intensity you need and the sufficiency of funds for them to have a problem catching up with the forerunners. So we need a plan of investment in human resources. And let's close with this so that we can move on. So in a permanent way, through an improvement of the conditions and the remunerations, with full and exclusive jobs, and this is a point that we will disagree, of course, and definitely with incentives, particularly with those structures that in the insular part of the country cannot, at the moment, sufficiently attract doctors, and they cannot respond and meet their goals and their targets. We need steady points of health service there. I mean, the example of Paxi is something that no one could disagree. I mean, we don't need a 400-bed hospital on Paxi, but we need a pediatrician in Ikari or on Sami.
We need some time for the questions after your interventions. I do understand what you're saying, that we need to have continuation in the good practices. I see that you agree, but please allow me, in my capacity as an observer, though you agree, you tend to disagree in your public discourse. So I want to give the floor to Mr. Giannitsis. How do you see this discussion going on? Under which circumstances can we expect consensus in this area? Thank you, and thank you for the invitation to be in this conference. I'd like to thank Mr. Bekatselos, the president of the chamber. You know, when I received the invitation, I remembered something that maybe you remember. Nikos Egonopoulos, do you know this name? A poet, a surrealist. There is a verse in one of his poems saying, "General, what did you want? Why were you in Larissa? You are a Jew." So That's how I feel now because everybody has a relation with each other. I am like, the outsider. Nevertheless, I am here to speak about certain topics, and I have thought about these because they are very interesting. So I shall try to share with you my thoughts organized in five remarks. Number one, the recent COVID crisis showed that the risks in the health system as a tool to deal with these risks can very quickly become a normality, and the politicians in general have to be able to respond to new unprecedented problems. Let me note that the fact that a system like the health system can go through several changes and be extraordinary instead of ordinary based on several crises, this can be a problem for many other types of areas of policy, not only health policy. And it's not only the policy that is going to provide measures or solutions to the problems that you have painted throughout the morning. Second remark, consensus, commitments, and collective action. I think that this is much more important than we tend to imagine. Obviously, there is a misinterpretation here that there is no consensus. This is not true. There are huge consensus in a very specific area, which is do nothing. We all agree that we do not do anything. Many stakeholders agree that they won't do anything, no matter what the problem. Of course, I'm not speaking about consensus at the lower denominator, but a collective action could be today a critical term for the success or failure of a political endeavor. For which are related to the new landscape for two reasons. First, the pandemics, as you know more better than me, are connected to many unknown factors and can be global. And second, the health problems are not a localized problem. They are a part of a new category, unprecedented global risks, as for example, at the model of climate change, climate immigration, etc., that cannot be dealt with locally by a country alone. So we need to have the synergy of several countries that will work together. If we had only some health problems or a pandemic, it would be different. But now we have another situation. We have many crises together. And we might have unprecedented incidents. So if you want to deal with such a threat as health problems, for example, this would mean that you cannot act individually, but you have to prioritize your problems because a government has many types of problems. So you need to take money from somewhere to give to the appropriations of health. If we have multiple risks, the more protection that we want to give to a specific of the risks, the less efficient you will become in dealing with the other risks. Point number two, consensus is necessary not only during pandemics, for the health system, but for many other reasons. Of course, we have demographics, which presents an obvious aging problem, but the reasons are that the developments that we go through are not just developments, they are a paradigm shift that disrupt our daily life. The problems today are very complex and difficult to be acknowledged by the current political mindset. The political profile of society is important to take into consideration. I believe that all governments are condemned to be unsuccessful if they have to deal with multiple problems. Every government will know that they have many failures to face because it is humanly impossible to deal with so many different serious problems successfully. Nevertheless, many societies, ours included, are characterized by acute and artificial collisions sometimes. Collisions just for the sake of the conflict, without any reason whatsoever. And the major question here that it relates to the central topic of our panel is how to reach consensus and what kind of consensus when the elements of political careers are at the other side of society's growth. Remark number 3, we do not know beforehand when the menaces are going to be actualized, how and when, and since it is impossible to have beforehand an efficient defense system to deal with all kinds of risks that might come up, it is logical for somebody who doesn't know the details of the medical fields to provide a strategy of a flexible organization and structure of the health system. This is not logical, and it's not logical to have standalone infrastructures here and there in a country without having an overarching planning. Of course, the health system is very sensitive one and has very specific characteristics. You need to be prepared so as to intervene efficiently. Such a strategy is related with funding, of course, organization of the system, new facilities, new specialized knowledge, and the organization of different mindsets and synergies in between different bodies. I know that the pharmaceutical companies in Greece have achieved very important milestones during the last 15, 20 years. This is also related to the services provided by certain professionals in the medical area. A critical economic denominator to all the aforementioned in order to have the equipment and infrastructures and the medicine and systems in place. So a denominator for any major issue is productivity and the achievement of good growth rates So this is another type of discussion related to the success of policy making in general. If we have a growth momentum, then a government will be able and well motivated to face any type of menaces, because the need to accumulate resources to the hotlines will not make you absorb funds from other serious areas of your policy. On the other hand, a low growth rate has, of course, several impact to society, but also low remuneration to the medical professionals. Remark number 4. In the conditions that are going to prevail, the state is going to play a very important role. Everybody speaks about the state without any ideology behind the discussions, and they all want to understand which is going to be the role of the state. But not any state, not a state that will have certain partisan or political preferences and do not deal with the problems, but rather with other dimensions of the problem's expressions. But apart from the state, we also have the political system as a whole, the political powers, forces, and bodies and persons. We need a more open system of critical thinking and understanding collective values and purposes that will refer to both bodies, institutions, and persons. We need other types of behaviors, other types of awarenesses. The problem is that today, the society, in less than 15 years, has gone through uh, three important turbulences: political crisis, an economic crisis, a social crisis, and a health crisis. For this reason, we have seen in the society skepticism about the main values. The GDP of the country is suffering. The GDP of the country in 2022 is equal to the one we had in 2004. This means that we have worsened our position, and that's why the population do not trust the politicians, and they do not seem to embrace rationality in their positions or decisions. And this seems to be very well weaved with the people's mindset. I've seen, for example, behaviors during the pandemic. So I believe that an overall, a holistic involvement of the society, along with the states, the government's policies, can ensure success of a policy. Of course, I do not have a specific example in mind where Athens, for example, or other major cities or areas in Greece will be extremely so happy as to go out in the streets and shout hooray. But of course, we understand that the problems are here, and the problems make us fail. And remark number 5, my last remark, we saw that there is disagreement in between parts of the society and the policies. We saw responsibility and irresponsibility at the same time in the same policies. I think we need to have a way to give efficient solutions to major problems, no matter what the reactions of big parts of the populations might be. We need to see how we can continue, no matter whether people react, without, however, being authoritarian in our governance. Of course, I cannot speak any solutions. The solutions are not a matter of a person, but a matter of group work. Trying to be politically correct regarding the characteristics of people, we have also to consider that responsibility is an important characteristic for everyone, especially in positions of power. Thank you. I do agree with you that we are at an age of disruption. We see the paradigm shifts in many areas of life, but of course the political system is to blame for this. Sometimes it conceals the problem. In the health area, for example, we do not have any reserves. So if a need emerges, we don't have the means to support it, to support the solution. Also, it is problematic that health expenditures are considered to be costs. We do not understand that this is also an invention, an investment. A higher expenditure for health services is depicted as cost only. I do agree with you that sometimes, if the governments try not to make anyone unhappy, then they cannot be function. They cannot function properly. Because accountability has to be taken into consideration where decisions and political decisions are taken. Not all people, not all politicians agree with each other. We have our differences. So let me ask another question. What about populism? Did you recognize the populism that in the public discourse during the pandemic, for example, vaccination, etc., which made people not having confidence in the proposals that the government made? 99% of the scientists said that this is the situation, while people would believe something totally different. So we had the conspiracy theories, etc. How do you comment on this?
Well, of course, it was cause of concern, not just from one part of the health system, but all this negativity, what it did is it hurts, and it's been mentioned by constitutional specialists and everyone, but it was not stressed as it should have. I mean, you can't attack a fundamental right of someone, which is health, life, or death, because you have this or the other opinion. This cannot be done, or even if it's done, we need to see why. Second, what I saw is that it did not only concern Greece. I mean, we thought that it was only us in the beginning, and this is what makes us feel that we are this way or another. Of late, I don't mean the past 2 years, I mean the last 6, 7, 8 years, we saw that in many societies that we considered as operating in a rational way or a more effective and efficient way, we saw phenomena and things that well, went above and beyond the criticism we had for our own selves here in Greece. This, of course, raises a wider and deeper concern and a problem. Phenomena like pandemics are not opportunistic and are not once in every while, but they're far more frequent, not in the form of the pandemic, of course, but in the form of something like that. So the question is, what happens when large parts of the society cannot agree and support, well, efforts that, does not need unanimity, but huge chunks of society need to support it. And if they need to follow policies because people are offended because they think they're heard, but being offended is different than reacting just for the sake of reaction. So there one needs to see how societies operate under this new system. Disagreements like the ones we had in Greece and elsewhere are the best recipe for failure. And this is something we've seen, how societies that have managed to come into terms and agreement in their interior, historically, not just now, have made it better, much better than we have. Societies that only live in dissent and dispute and in disagreement have managed to be much more regressive. We believe that say fakir in India does not care what happened in the civilized world as per capita income. I'm happy to be here, so that's the end of the story, okay, end of the line. Right, thank you very much. Mr. Vardaros, if I may to say something about what you said earlier. You said that the private sector cannot support prevention programs. Now, this huge fragmentation and compartmentalization is socially wrong. It's not important who holds the means of production. The matter and the issue is to have access to the services without burdening themselves financially. And as an example there is the 11,000 private pharmacies. So when someone goes there and exercise their insurance right, do not go to the private sector, they go to what we call the social state. So I think that you have over-evaluated and overstated the position of the means of production. A certified medical center or a certified pharmacy is part of our social state. It's not something outside of it. And I'm saying this because you mentioned earlier that prevention programs cannot run like that. If there is central planning and the population's targets have been defined, etc., etc., there is nothing wrong, and it has nothing to be jealous of from any other system. And we're talking about the flexibility that is much more rational in the private sector, and it's much more speedy implementation. This is like a remark, but I would like your comment. And I have a question. Did the government do everything wrong in the management of the pandemic? Did you disagree with everything? A second, you talk about hiring and new jobs, and I have the same question for you, Mrs. Gaga. Have you evaluated the needs? So if I came here with a bag full of money and I said, hire as many nurses and doctors you need and I can pay for them, do you know where they will go, to which structures and why? Do you know where the gaps are and say we need 5,000 nurses, or is it just a number you're tossing around because it sounds good and it's attractive? This is my gravest concern, that there is a planning not on the basis of documentation and evidence-based, but just to sound right. And this is a question I have for the both of you. And one last thing. People accuse you that you didn't have a clear-cut position during crucial and critical period for various issues such as, for instance, vaccination. These are my questions, and I would like to answer very, very fast if you can. Well, Mr. Souliotis, it's impossible to answer these questions shortly. First of all, I agree with the ascertainment. It's not the approval of a theory. There is no, fixation as to who holds the means of production, but history in this country has shown that the private sector, or rather I have a feeling that the optimum use of resources is not something I see happen everywhere in the public-private sector, rather. There is a difference, a value difference. The public health system meets the needs for health services, and the private sector has, not always, many a time, this, induced demand. And this difference causes distortions. What I said in my initial introduction is that when you have public structures that incorporate and integrate a series of functions under the wider umbrella of the primary healthcare with integrated health services, this example is something that you carry on, you evolve it, you develop it. If there are difficulties, you evaluate and assess it, there are positive evaluations, and you correct. You do not leave it stagnant for 3 years, allow it to fall into disrepute through the non-use, and then update part of the previous planning, the private doctor, and say that I will introduce protocols, I will have them participate in prevention programs and this and that, because I've come up with resources. Because this is not rational either. This was the substance, the essence of my previous remark. Now, regarding staffing, yes, we're talking about quantity, but at the same time we need to redesign what needs we want the health structures all over the country to cover. I do agree that we need to redesign and redefine the health map and the health services map in the country, and we need to develop new services that the SC, the National Healthcare System, has no presence. I mean, in physical rehabilitation, there are very few structures, and they are underdeveloped. So it will help us to have to evaluate all this in terms of public interest and trying to achieve better services at better prices. Now, this is not something we heard, but this is one of the targets. So regarding the last part, so yes, staffing. We have the plan regarding the 15.5 thousand hirings. It's to have new permanent hirings, to have permanent jobs. We are making a comparison with the permanent post, because these permanent tenders may work and say that, well, we did advertise a position on Kalymnos and they didn't go. So we need a continuity here. We need a prospect. We saw this during our time in power, when people were in Germany, for instance, and their primary care was not the wages and the salaries, because they couldn't have comparable salaries in Greece as in Germany, for instance. But they want to have a prospect that there is a plan, there is a design for more jobs to open up, and I need to have some job safety and security when I go to serve in such a structure. I will not be alone in a clinic. There will be other doctors for support, and I will have the support through telemedicine by a reference center or a university center, even from the mainland, from the continental country, from the more central health structures. So this answers the losses we had, not in 2019, but even in 2015. We had a 5-to-1 hirings to hirings ratio by the institutions. So we needed to have this keep going and not have it interrupted through the replacement of many people by people with contract holders. So this is part of the incentives to enhance and support the health system. And the last thing you raised was whether our position was clear or not on key issues. I think we were very clear and very timely when we talked about vaccinations, our official position on vaccinations. SYRIZA, Progressive Alliance, through our president Alexis Tsipras and through Andreas Xanthos, the unit head. So our position was that of in support of the vaccination campaign. In symbols and in essence, they were the first ones to vaccinate themselves, our members, well, most of them, and they were there all over the political spectrum and all over society. And Professor Mr. Giannitsis said things very, very correctly. There were different voices heard. It is part of a democracy, isn't it? There were different voices heard within the very health system. So one disagreement we had Was that regarding the employees of the healthcare system that were suspended? I mean, it is irrational, okay, for people who were not vaccinated for this or that because their education was problematic or the training was problematic, or because they were misinformed or uninformed, or they were not the recipient of targeted information. We had many cases of nurses, young girls, who listened to OB-GYNs who said, if you are pregnant now, the child will be born with problems. So there was a huge impact on behalf of the church. Many religious people working for the healthcare system were influenced more by the theological indoctrination rather than scientific truth. We did see these things as well. But we supported back then, and we still support now, is that especially for those people, you could have adopted increased safety measures for them and the patients and the rest of the staff to be active, because it was like shooting oneself in the foot to take these people offline at a value level as well. It is perfectly acceptable, the right to protect public health, but there is also the equally respectable right to employment. These were not people who had, well, most of them multiple sources of income. Their salary was their livelihood, and they were put off the health system in an exaggerating or authoritarian and unfair way. I don't know whether I covered all the questions. Yes, absolutely, says the moderator, who gives the floor to the alternate minister to close this meeting and to comment on what was said. And I have one question for you. If you have a plan for the evolution of the national healthcare system and an answer to the accusations made to you that you did not enhance the national health system primarily during the pandemic. Now, I've been working for 35 years in the national health system, not one or two, from the time that I was an intern. Well, you don't look it, madam. Right, well, thank you, but I do believe in a national health system that is flexible, that follows the times, that follows the wishes of the patients and the wishes of its staff. You already spoke, Mr. Souliotis, during your introduction, that 1/3 of the patients wants to pay for something. Now, in the morning, we were in a telco with the WHO, and the first speaker was Dr. Crook from Harvard University, with whom we will run a study now. Because we're very interested in the health services users' opinions to design everything. And he said anywhere between 10 to 35% health users in health systems such as the French one or the American one are not satisfied with the way the health system deals with them. So the first thing we're interested in is for health users to be satisfied in the way they're being dealt with, that their needs are met. And health workers, health professionals, to feel that they are productive and that they are remunerated appropriately. Now, when they were suspended, I was not with the ministry, I was with the hospital, and I thought that reasonable because we were missing people. I went to Giannitsis. One of our colleagues was in Hippocration in Thessaloniki, and we didn't have the COVID vaccination yet. So it was very important that we lost people, and it's not reasonable as the government to say that I will leave those who have this opinion to join a COVID department. It's perfectly reasonable. It's not just for public health, it's for public health as well, but it was primarily for the protection of themselves because people were lost. Healthcare professionals were lost. Things have changed. It's something we see, and we'll probably make another decision. We can see this as per the epidemiological data because we have other issues that concern all of us. So, in order to make health planning, we need to have data. I hear what you say about the region. I worked in Athens, and the hospital management never was accountable with the local community or anyone. Now, whatever we said was not met with any interest. But truth be told, local society is very important, but the local society cannot do health design and planning for a country, for a government. Let's say we have the island of Rhodes. There is a hospital in the northern part of the island. If someone wants to go from Pefkus or anywhere south, will need 90 minutes driving. So we need to have another health structure closer. We also need some specialized doctors. We will go there some days. Now we have Lasithi. 4 hospitals, population lower than Rethymno with 1 hospital, doctors twice as many as Rethymno with fewer population. There's no reason in this, there's no rationale. So people need to have their hospital, they need to have their care, but we can't need 150 doctors for the same population that need more people there. So it's something that we need to see as a society, because I need to remind everyone that free of charge is something that means that I, as the Greek taxpayer, pay, and the money I pay is managed by the government and it channels them somewhere. So I need to pay the money to have a viable and sustainable system. So the only thing we need more is data. What do we need? We need to deal with emergencies appropriately. We need to deal with chronic diseases appropriately. We can't have surgeons or neurosurgeons everywhere, but we need to have a standardized procedure on the basis of which patients will need cardiological surgery or neurological surgery to have them, or to schedule surgeries that can also be performed in small hospitals, even if we need to have teams of people to go there. This is something we will discuss. And there we need consensus because it concerns us all. I need to say that at this point that trust is something that we lack in Greek society. Why? Well, because the state, through time, does not handle and does not take citizens as sincere and honest. And the same goes with the citizens. And the biggest problem of the Greek state is that everything changes day after day. So you try to do some programming or a planning, you're a businessman, you start a business, and in 3 months the law has changed and it's different. So you go as a doctor to some place and in 3 months things change and you need to do something different. So this is impossible. The consensus we need is for the long-term planning that we all need. What we also need is to clarify our laws. So the 3 things that I need, we need to keep as a take-home message and have a consensus is to listen, agree, and that we are there to listen, okay? It does not mean that we will all manage things together, we'll make the decisions together, but it means that we will have listened to everyone before making the decisions. The decisions need to be made and they will be made. And truth be told, decisions must not be changed the day after. We had a meeting with BIS yesterday. I said 3 things. Out of these 3 things, our colleagues do 2 of them and use them to their benefit. It's not a political way to work. We say the whole truth and we move forward. When I go out and say that Greece has more cardiosurgical centers than we need, and the minimum cardiosurgical center costs has 650 cases, and the other person says that they have cardiosurgical centers we need more depending on the cases, these are not the data. The data say that the smallest cardiosurgeon has 650 people. It's not 12 centers per population. England may perform surgery on half Egypt and half India or France or anything. Their cases are there. It's not only that their cases are there, it's written how well they did and the mortality they have and the disabilities they have. These are the things that we need to follow all together. We need to put forward and to start. We want to have high quality health services and we want to have high quality health services everywhere, and we want to have the new drugs. We want to have drugs that we will not spend the whole budget off indication, but where we need in the patients who will truly make a difference in their lives. We see about drugs in cystic fibrosis that have changed the lives of children who would die at the age of 20 or 25. Now they live good lives with high quality. If it's 200,000 euros per year, we need to pay 200,000 per year. This is worth it. We need to think about other things, and we also need to think that at the moment we don't have rules for specific things. We have hospitalizations abroad and drugs that cost 1,800,000 because someone shouts and takes it. It's not a way to work as a state. The way to work as a state is this. These are the rules. The basis of these rules that are the same for everyone, because we are a state of we are here. and we are a state of law or a rule of law, this happens not because I have a friend with the government, I receive the drug because I put pressure. These are things that we need to say for everyone to know. We clearly want what's best for all patients. We clearly want what's best for Greek citizens, and this is definitely the best for everyone, not for the one who shouts the most or the one who raises the more havoc. This is what I can say. Let's keep this as a take-home message, and the best condition to have the wider consensus and consents is to have discussion, and not just discussions behind closed doors with pressure groups. The request for democracy in health is here. We evolve as a country, and we need to congratulate you for the initiative, and the previous government did a similar attempt. We're talking about patient centricity, and we need to go by the law. The health systems serve patients primarily, and secondarily their creators. I would like to thank you all very much, all speakers, for this brilliant discussion. We have a light lunch break, and we will be back in half an hour's time.